Hey everyone. So today we're going to talk about a virus that, well, you might not have even heard of it. But trust me, public health experts, they're keeping a very close eye on this one. It's kind of like a hidden threat, but it packs a serious punch. We're talking about the Nipah virus. All right, so let's jump right in. Picture this. It's 1999 in Malaysia. A really strange medical mystery starts to unfold. Pig farmers are getting sick with this severe and often deadly brain illness. And at first, nobody could figure it out. I mean, what could possibly connect these sick farmers, their pigs, and, get this, fruit bats?
So this was it. This was the moment that really opened the case on Nipah. It was basically the world's first introduction to this brand new and, frankly, terrifying virus.
And here's the thing. What started in Malaysia, it didn't stay in Malaysia. Just 2 years later, in 2001, boom, it pops up in Bangladesh. And from that point on, these outbreaks started happening almost every single year in that region. So yeah, this was definitely not a one-time thing. It was becoming a serious, ongoing threat. Okay, so with the virus spreading, you can just imagine the pressure. It was a race against time for scientists to figure out what in the world was causing this. And the answer, well, it was about to introduce us all to a new and very dangerous member of the virus family. Now, to really get a handle on Nipah, you need to know this one word, zoonotic. It sounds complicated, but it's not. All it means is that the virus can jump from animals to humans. And believe me, that is a key piece of this whole puzzle. And so, they found it, the culprit. Scientists finally isolated it and gave it a name, the Nipah virus, or NIV. The mystery illness wasn't a mystery anymore. And that name, Nipah, quickly got a pretty scary reputation. This is what's really terrifying. Take a look at this number. The fatality rate for Nipah is somewhere between 40% and 75%. Let that sink in for a second. In some outbreaks, that means that for every 4 people who get sick, as many as 3 don't make it. That is just incredibly high. Okay, so now they had a name for the killer. But the next big question was, where did it come from? What was the source? So investigators started following the clues, trying to trace it back. And where did the trail lead? Right here, to fruit bats. Specifically, a family of bats called Pteropodi. These guys are what we call the natural reservoir for Nipah. Basically, they carry the virus around, but it doesn't make them sick. This makes them the perfect silent carriers, spreading it wherever they fly. So, the big question is, how does it get from a bat to a person? Well, it's a chain of events. An infected bat could, drop saliva or droppings onto some fruit or into a container collecting date palm sap. That's one way. Or it could infect another animal, like a pig, which we call an intermediate host. Then a person gets sick, either by eating that contaminated food or by coming into direct contact with the sick animal. And once a person is infected, guess what? It can then spread from person to person. And what's really wild is how adaptable this virus is. It's like it finds different ways to spread. In that first Malaysian outbreak, it was all about contact with infected pigs. But then, when it showed up in Bangladesh and India, it switched up its game. The main route became contaminated date palm sap. And, really importantly, it started spreading much more easily from person to person. And this is a really important point. Just look at this quote. In Bangladesh, for a stretch of about 7 years, around half of all the cases were because of human-to-human spread. This happened when people were just taking care of their sick family members or for healthcare workers treating patients. It means that every single case has the potential to start a whole new cluster. It puts families and doctors and nurses in a really, really dangerous position. Okay, so we've tracked where it comes from and how it spreads. But what does it actually do to a person? Let's take a look at the human cost because it's pretty devastating. At first, it can seem like a bad case of a flu. You get a fever, headaches, your muscles ache, pretty standard stuff. But then it can take a very dark turn very quickly. People might start feeling dizzy, confused. That's the virus attacking the brain. This can lead to something called acute encephalitis, which is basically severe swelling of the brain. And from there, in the worst cases, it can cause seizures and a coma, sometimes in just a day or 2. And this is the really tricky part, because those first symptoms are so generic, fever, headache, it's super easy to miss what's really going on. By the time a doctor might even think, hey, maybe this is Nipah, the virus could have already done some serious damage to the brain. And that makes trying to treat it, well, incredibly difficult. And this This is the stark, cold reality of the Nipah virus. There is no specific treatment. There is no vaccine. Not for people, not for animals. The only thing doctors can do is provide what's called intensive supportive care. That just means they do everything they can to manage the symptoms, help the person breathe, and basically just hope the patient's own body is strong enough to fight it off. Okay, I know that sounds incredibly bleak. And it is. But here's the thing. When you can't cure a disease, you have to pivot. You have to focus on the one thing you can control, and that's preventing it from spreading at all. And that's where we come in, because knowledge really is our best defense here. So let's start at the very beginning of the chain, the bats. How do you reduce the risk of it jumping from a bat to a person? Well, in places where Nipah is a concern, there are some pretty simple but really effective steps. Things like boiling fresh date palm juice before you drink it, washing and peeling all your fruits really well, and if you see a piece of fruit that looks like it has a bat bite on it, just toss it. Don't take the risk. Okay, what about the animal to human risk? For anyone who works with animals, like farmers, it's all about creating a barrier. That means wearing gloves, protective clothing, especially when you're handling a sick animal. And if you even suspect an outbreak might be happening on your farm, you've got to quarantine the area immediately. You have to shut it down to stop the virus right there. And lastly, how do we stop it from spreading between us, between people? Well, these are prevention methods that, honestly, we've all become experts in recently. It's about avoiding close contact with someone who's sick, and the big one, washing your hands thoroughly and often, especially after caring for someone who's ill. For doctors and nurses on the front lines, standard infection control is just, you have to do it. It's not optional. So all of this brings us to one last really big question. We know Nipah is a serious threat. We've seen how it can adapt and find new ways to spread. We know what it does, and we know we don't have a cure or a vaccine. So really, it's not a question of if there will be another outbreak. It's a question of when. And that leaves us with the most important question of all. Is the world ready for it?